Hi, and welcome to Sports Medicine as a Naturopathic Niche. I am Dr. Joanne Yanez, the Executive Director for the Association of Accredited Naturopathic Medical Colleges, and welcoming you to our webinar today. We are going to be starting in about 1 minute, so hold on tight. Go grab your tea or your water, and we'll be ready to rock and roll in just a minute. Thanks for coming. Hello and welcome to the AANMC webinar, Sports Medicine as a Naturopathic Niche. Today we have with us Dr. Michael Bastien. But before we begin, I just want to talk about a couple of housekeeping things. So we get asked a few questions pretty regularly on these webinars. Number one is, will this be recorded? And yes, it will be. The webinar recording will be up on our website, hopefully technology willing, later on today, at the latest tomorrow. We will have a recording available for those of you who either want to replay it back or who have missed some of the recording. And so to Dr. Michael Bastien, we will be taking questions at the end of this webinar. And so if you have any questions, please use the question box over there, and I'll try and triage some of them as they come through, and any that are directed better for the webinar presenter today will be answered at the end of his session. So with that, I want to introduce Dr. Bastien. I'm very excited to have him with us today. He received his undergraduate degree in kinesiology, specializing in rehabilitation and health from Simon Fraser University, and received his doctorate in naturopathic medicine from the Boucher Institute of Naturopathic Medicine. He's been an instructor in their physical medicine department at Boucher since 2010. Since starting practice, he's completed training in prolotherapy, prolozone neurotherapy, neuroprolotherapy, concussion identification and treatment, hormone replacement, and many other therapies. I'm very happy to have Dr. Bastien in with us today talking about sports medicine. I know that, it's the summertime, lots of folks are out and about, and this is very topical. So with that, I turn over the stage to you, and I'm going to make my face disappear, and hope that you all enjoy our webinar today. Thank you so very much.
Okay, hello. So, yeah, I'm Dr. Michael Bastien, and my practice here in Vancouver focuses a lot on sports medicine, injuries, and helping people recover from those sorts of things. So here goes. First, can I forward the slide? Let's see. There we go. Okay. First, a little bit about how I kind of got started in brief. When I was a kid, I would go see a chiropractor, and he really inspired me to get involved in medicine. I thought, the things that he was able to achieve seemed really, really neat and amazing. That was kind of what I thought I would want to get into. So all through kind of high school and then my undergrad degree, I kind of knew that medicine was where I wanted to go, and it was really a question of what was the main discipline I really wanted to get into, because there's a lot of options out there. If you do your pre-med, you can get into physio, you can get into massage, you can get into chiropractic, you can get into naturopathic medicine, you can go into traditional medicine. And so through meeting with my chiropractor and discussing kind of the options with a local naturopath here, during my kinesiology degree, I discovered that I probably wanted to do naturopathic medicine over doing chiropractics. And I'll talk a little bit about that kind of at the end as well, but it comes down to a lot of, how you want to be able to practice and the things you're able to do, and the types of conditions you're able to try and address. And also, because I was going to be hopefully being able to work with my chiropractor, It wasn't going to be as good if I was going to be his competition. It was going to be far better if I could be, alongside him, working with him with his patients that already existed. So I did my undergrad in kinesiology at Simon Fraser, and then after that I went on to take my naturopathic training at Boucher, and then shortly after graduating I started TAing in the phys med department, and then continue to teach there now. And of course my private practice, I'm here Monday to Friday in Burnaby, and we deal with a lot of sports injuries, motor vehicle accidents, just general other injuries, chronic cases and acute cases. So it comes in many shapes and sizes. As far as the niche of naturopathic medicine for sports medicine, there's a lot to be really worked on. And the main thing to keep in mind is you're not really able to solely focus on just an injury when trying to get someone recovering, and also for some of those chronic cases where they haven't recovered fully, you're not going to get resolution of these more tough cases if you don't address this body as a whole. So on a very basic level, you look at, do we have any kind of structural malalignment that's leading to chronic pain or leading to dysfunction, and we have to try and correct that. And so, that's going to involve spinal manipulation, and that's also going to involve, assessing soft tissue involvement. So is there any kind of trigger point issues? Are there tight muscles? Is there range of motion limitations that are perpetuating some of the problems? There's a number of kind of different, from the structural perspective, we have to try and address. From the digestive perspective, we can't really heal well if we aren't getting nutrients in to recover. And there's a lot of times when either the people that came in weren't digesting well to start with, or after the injury, digestion kind of suffers because of either the stress of the injury itself, or just the habit changes or the lifestyle changes that have occurred. But it's really important to have that digestive functioning happening. Otherwise, they're not going to have those cofactors they need to repair. So that becomes a big part of a lot of people's cases, because you see a lot of use of antacids and you see a lot of use of other digestive supports for kind of an under-functioning digestive system, which means they're not going to be able to repair as well. Another component that's come up more recently, say in the last 5 years or so for me, is the hormonal component. And this relates much more so in the cases of chronic concussion conditions and traumatic brain injuries and those types of injuries, where because of the trauma to the brainstem and to the brain itself, there can be a loss of the normal regulation between the pituitary and the glands in the body that produce through different hormones. And as long as that communication is not occurring the way that it should, we will have either subclinical or clinical hormonal deficiencies, which will impair your ability to recover. If you think about, as an extreme example, people doing anabolic steroids, the reason they're doing anabolic steroids is because that makes that muscle grow. They're able to put their body through intense routines and still recover from that injury essentially they're creating from their exercise. And so if you have that in excess, you get really big and it has its own health risks. But if you're deficient in those hormones, you don't repair the way you're supposed to. You don't have the energy you need. And especially when it comes to more of the concussion syndromes where we're talking about, mood issues and anxiety and depression, again, those are symptoms of hormonal deficiency. So it's not just about muscle on its own. It's the whole body that can be affected through hormonal dysfunction. The final piece I have on here is about regenerative medicine, which is the thing that I do most in my practice here. So at the office, we have chiropractors and physios and massage therapists and personal trainers, and we all work together to try and get these patients recover the quickest they can. But the thing that the other practitioners in the office can't do is injection therapies. And so that's typically prolotherapy and platelet-rich plasma, which are basically all along the same vein of trying to repair that connective tissue by activating platelets in those areas to regrow that connective tissue. There's other components to regenerative medicine like neuroprolotherapy, which is involved primarily for nerve compression or nerve injuries, which usually will come in kind of later in the recovery process. There's also prolozone and ozone therapy, which can be used kind of throughout the process and have a similar kind of method or concept to prolotherapy and platelet-rich plasma, but again, activating it through ozone rather than activating it through platelet activation. So there's a few different kind of specific modalities that the regenerative medicine kind of encompasses. Now, as just a very brief kind of statement to say that this isn't purely kind of pulled out of nowhere. There is a lot of evidence for the use of naturopathic medicine, at least the components of naturopathic medicine within sports injuries, within injuries in general. And this is just a couple of pieces to kind of give an example of it, although it by no means exhaustive and by no means fully encompassing all of what we're going to be talking about. But just understand that this really is rooted in a lot of research and study on how to make your body recover better and how to kind of achieve that optimum health. The first case study where I want to show you guys or tell you about, so a 36-year-old female, she came to me 3 years after a motor vehicle accident. So she was a police officer on duty and she got rear-ended and had significant post-concussion syndrome symptoms. So she had vestibular deficits, which means she had balance issues. She had difficulty kind of with objects moving around her quickly, so crowds became really quite hard. A lot of that noise and lights that can occur from being in a very busy mall or a crowded area really would set her headaches off and would just make her very disoriented. She had memory issues as well, where she wasn't able to recall or even just process stuff the way she used to be able to. She had significant neck pain and jaw pain. So much so that it was, like I said in the slides, difficult for her to even speak and chew sometimes. And so that's a pretty significant impairment for her, and she wasn't really super happy about the care that had come so far. On top of all that, digestion was an issue for her as well. She tended towards constipation, and with that, some gas and bloating. And so again, one of these cases where you can't just look at the physical injury, you have to look at how the body's functioning. Will it be able to repair? And so we had to work on digestion as well for her. So beyond doing just a little bit of digestive enzyme support and kind of counseling around diet, we did a lot of the physical components. So we did soft tissue therapy. That means like massage and fascial work and that kind of thing on her shoulders and her neck and her low back, because although the neck was perhaps a major symptom generator, she still had also a lot of low back issues that were perpetuating some of the overall spine stiffness that we had to kind of deal with. So we did, adjustments on her neck and on her low back. And then quite quickly, we went into doing some prolotherapy for her neck and her low back, because these injuries have been going on for 3 years. If they had been something simple and could have been recovered on their own or could have recovered on their own, that was like 2.5 years ago. By now, we're into this chronic state where the ligaments aren't recovering. And so we have to step up and go a little above and beyond just waiting and kind of a bit of rehab exercises or something to try and get her to the point where she's going to be functioning better. And another component, because of the vestibular symptoms she was getting and the concussion symptoms she was getting, we talked about doing hormone testing to find out if there was any kind of hormone dysregulation for this patient. And not surprisingly, given how long this has been going on, that we did find quite a bit with that. And so by the fourth visit or so, we'd had significant improvement in her jaw pain and her headaches. So no longer was she having issues where she was having trouble just being able to eat. She still had a little bit of like upper neck pain, sort of just below the ears kind of thing, like a C1. And that was something we continue to work on. We've seen her since these fourth visits, obviously. And that But overall, we're getting a lot of improvement from doing the prolotherapy, from doing the soft tissue therapy, from doing the spinal manipulation. Once we started adding the HRT, the hormone replacement therapy, to her regimen, is where we're really starting to see those leaps and bounds occurring for a lot of the vestibular issues. So in her case, there was some issues with testosterone, there were some issues with estrogen, and some issues with progesterone. And so in BC, the scope of practice doesn't allow me to prescribe testosterone. So in those cases where we have that, we have to then work with additional health professionals. And so we had to send her off to another doctor to have that testosterone prescribed. But it made a huge difference. It really turned her around. And it's something that's really important for a lot of those chronic brain injury cases. I emailed her to kind of confirm that she was okay if we talked about the story in this webinar. And
We've lost audio on you. Michael? Michael, I've lost audio. Hello, Michael? Michael? Oh boy. Sorry, folks. I don't know if you can hear me. Oh gosh. Michael? Michael, we lost your audio.
All right, am I back?
You are back.
Oh, sorry about that. At what point do I need to go back to?
Probably back a slide or two.
Okay.
Maybe next one. Lost your audio again.
If I do this, how's the audio now?
It's good. You're back.
Say goodbye to the headset then. Sorry about that. Okay, I guess we'll go back to this slide then. Sound good?
I think you could probably go one more.
One more ahead there?
Yep, there we go.
Okay, so sorry about losing the audio on this. By about the fourth visit with this patient, we had a fairly good improvement of her headaches and her jaw pain. So there was still more work to be done, but at least we had significant improvement on that front. And so we started talking about whether or not there was a hormonal component to her injury and what we needed to try and do for trying to correct that. So what we do is we do a whole list of hormone testing to kind of see where where they are and see what might be underfunctioning, what might be kind of overproducing. And for her, there was a significant amount of issues. A lot of it related to, if I remember correctly, sex hormones. So it was estrogen and testosterone were things that were the pieces that were the most out of balance. And so for her, we started her on those, and that's really when a lot of the energy recovered and the vestibular symptoms start to improve, and a lot of other, most like post-concussion syndrome symptoms started to fade away, right? So the memory was able to work a whole lot better. And one thing to keep in mind from a jurisdictional perspective, if testosterone is low in BC, at least in pretty much all of Canada, and naturopathic doctors don't have access to prescribed testosterone. So then we start working with an additional team of medical doctors to provide that prescription. But it's, again, it's part of that whole blend of all the different hormones that she needs to make sure are in balance. Now, prior to putting this into my presentation, I'd emailed this patient to just kind of confirm that everything was okay. She didn't object to having me use the story as part of this explanation. So part of the response she sent was, "I wish I'd come to see you sooner. I can't explain how disheartening it was to have several specialists on so many occasions tell me I was never going to get better, and to learn to adjust the way I do things." So it's a explanation and a response that I see frequently, especially for those chronic concussion cases, because when the medical system doesn't know what else to do, they usually tell you to just live with it. And it's really unfortunate because there's a lot that can be done, especially with the hormone replacement therapy and with all these other regenerative therapies to help these people manage these symptoms. And as long as we kind of tell them that's just the way that it is, we're really letting them down. And so hopefully with the work of myself and other doctors in this field, and also the awareness within the different sports disciplines of the broader therapeutic approaches that are available and helpful in these cases, that will become less common a story that we'll hear. But we'll see. The second case I wanted to bring you is a more typical acute injury case. So this is a 13-year-old male, came in, he was about a week after the injury. He had some lingering shoulder pain from a hit in hockey. He just started doing contact in hockey, and hockey is classic for giving you collarbone injuries. You get a lot of separated shoulders in hockey, whether or not they're first degree, second degree, or whatever. And so he came in, his shoulder was a little sore. We tried to do just some basic orthopedics and assessment, and you could see that his collarbone had popped up quite a bit. And when we came to do testing on him, even just activating the latissimus dorsi muscle would lead his collarbone to pop up way more than would be expected for just a minor first degree or kind of low grade second degree sprain. So I thought this was a great opportunity for me to really, educate this patient as well as kind of quantify exactly how bad this injury was. So I have an ultrasound in my office that I use for guided injections and also for sometimes investigating things like this. So we went in and took an image of his AC joint. So on the left-hand side, we have the collarbone. On the right-hand side, you have the acromion, which is the end of your shoulder blade. And in between them is your AC joint. And it's supposed to be under 4 millimeters. And for him, it was 12 at the time that I saw him a week after the injury. That's way too big. It's way, way too big. And we needed to make sure we tried to really address this quite aggressively so that this didn't become a chronic, really unstable AC joint, because it will lead to a lot of rotator cuff issues, which then perpetuate all sorts of pain syndromes within both the shoulder and the neck and lead to limited range of motion. If he really wants to be able to continue to play hockey, we have to address this pretty aggressively. So we did a little bit of work on his soft tissues. So we went in and did some massage onto like his delts and infraspinatus and supraspinatus and pecs, and trying to release as much of the tight muscles around it, because when you have an injury like that, your muscles around that joint are going to get quite tight to try and support that joint. And that's where a lot of this chronic dysfunction occurs from joint injuries that leads to a lot of muscle pain and a lot of muscle dysfunction. So we did that amount of soft tissue. We told him he's basically got arrested, keep the arm in a sling to, again, try and keep that joint closer together and tighter so that it has a chance to kind of recoil back together. We also did a little bit of prolotherapy. This is being a week in a little bit early, but because we know kind of the pattern that's going to happen with this injury, and we know he's wanting to be active in sports pretty quickly, we'll get in and do a little prolotherapy in these cases a little bit earlier, because it's important to try and get that any amount of extra boost occurring for that injury. So then we had an after, and unfortunately, I took the image as a mirror image, so I turned the probe the wrong direction. So these actually aren't different joints. They are the same joint, but unfortunately, they look like a mirror image. So before we have the collarbone separation there of 12 millimeters, and afterwards, a week later, it's now down to 9. So that's a lot of improvement, and that's really, really good for his overall function. His left shoulder has a gap of 8 millimeters to start with. So he may be one of those people that has fairly loose joints, and that AC joint may not ever shrink down to that ideal range of under 4. But at least we're getting that progression, and now we're sending him off to getting, physiotherapy done and active rehab to kind of get the muscle strength back, get his movement back, and kind of get everything functioning again the way that it should, while we, again, let this ligament injury heal. Even as far as alignment goes, you can see how much in the before picture, the collarbones popped up above the acromion, and the after picture, we're getting a lot more kind of level alignment, which is, again, good because it's staying where it's supposed to be. So a little bit on why I got into naturopathic medicine. I knew that I wanted to do medicine, like I said, so it was a question of, well, what is it you want to do? And the real bonus of being a naturopathic doctor is I get to set my own schedule, set my own hours, and kind of choose to do what I want to do. So when I had heard the stories of going into med school and going through residency programs, it didn't seem like something I was really into. The thought of having to do long 12 or more hour shifts and sleep deprivation and just the craziness that sounded like, it didn't sound like something that was going to be in line with my idea of enjoyable work environment. The biggest part, I think, that was the decider for me was the scope of practice. And then scope of practice varies by jurisdiction. And so for some areas, you're able to do more, and some areas you're able to do less. And it's worth considering where you want to practice as to understanding what their scope of practice is, because it's not universal. But in BC, we have a fairly broad scope of practice. I'm able to do the injection therapies, which you're not able to do in all jurisdictions. I'm able to do, nutrition, which you're able to do everywhere, but still. We're able to do acupuncture. We're able to do botanical medicine. We're able to do spinal manipulation, so the chiropractic side of things. We're able to do a lot, and therefore we're able to help people with a wide variety of conditions. You're able to help people with complex cases where it's not just a simple body injury, but there's other components, other biochemical issues going on for that patient. And so that was a big part of why I chose to do naturopathic medicine. The last part comes down to a little bit of, how you think medicine is best delivered. For me, the idea of having like a 3-minute appointment seemed kind of pointless, because I didn't think that was really addressing people as a whole and addressing all the issues that might be going on for them. We need to be able to spend some time with them and really listen to them and be able to, dig into some of these more complex problems and not just look at them as purely a list of symptoms that we could just manage with some medication. And so that was a big part of why naturopathic medicine had an appeal to me, because I get to, again, set how long my appointments are, and I get to choose what modalities I get to use. And then for future plans, one thing to keep in mind is that naturopathic medicine, like all medicine, is a lifelong learning experience. You're going to be having the opportunity to continue to evolve with medicine and learn new methods of treatment and learn new avenues of treatment. And so, when I graduated, I had my basic, set of knowledge base. So I knew how to do acupuncture and some traditional Chinese medicine. I knew how to do spinal manipulation. I knew a fair bit about nutrition. I knew a fair bit about botanical medicine. that I knew about homeopathy. And then after I graduated, I was able to get into getting into pharmaceutical medications, because again, in BC we have a separate pharmaceutical certification. I got into Prolotherapy, and then Neuroprolotherapy, and Prolozone, and this kind of goes on and on. We've done training in instrument-assisted soft tissue therapies, including fascial abrasion tools, and there's all these other little neat things I get to learn and utilize in my practice. But it does mean that you never stop learning as a doctor. The other part that I'm hoping we can start to do is really start to bring naturopathic medicine as a whole to a larger audience of sporting activities. Because right now, there's certainly some sports where they're a little bit more aware of it, but it's really in its infancy as far as fully accessing a lot of different sports teams and sports types. So I think there's a lot to be gained from overall longevity in your sport, to how quickly you can recover, to overall how you're going to perform, if we can incorporate naturopathic medicine and naturopathic principles with these athletes so that they're able to really perform at their optimum. The main thing I wish I knew, I think, that wasn't necessarily as obvious to me when I got out of practice, was that networking seems to be the best form of marketing. When I got out, I was out on my own. I joined a practice that was just starting up. There was myself, another naturopath, and some other disciplines. So we had midwives there, we had physiotherapists and massage therapists, and we were all kind of mostly starting out fresh. And marketing is really hard to figure out where you're going to spend your money, what's going to give you the most bang for the buck. And in the end, the thing that I learned over the last 8 years now is the more you can have that network of people that the community you're involved with, and the social groups that you get involved with, those are really going to be your best marketing tools. They're going to give you word of mouth referrals, which are usually the best type, because then those patients come in already knowing what it is that you do and what they're going to do, what you're going to do for them. So that was perhaps the one piece that, if you're going to go into naturopathic medicine, you'll find out at the end. But yeah, networking is a huge part. The last part, it's fairly evident to most people. It seemed like I had to learn this the hard way, which was joining a practice is always easier than going out on your own. Going out on my own allowed me to develop a lot of my own systems and do things and try things that I wouldn't necessarily have been able to do had I joined an existing practice. But it was really hard, and I really kind of wish that I had joined another practice earlier that had more existing practitioners operating there, because it would have definitely streamlined those first few years for me. This is my contact information. My website's there. The email link on my website's the same email as this in this presentation. So if you have any questions, feel free to email me. I'll do my best to get back to you as quickly as I can. My usual goal is within 24 hours. We'll see if I can stick to that goal or not. All right, I think I'm turning my presentation over now. Is that right?
Yes, thank you so much. So just before we get started on some questions, I wanted to just cover a couple of upcoming events that we have here at AANMC. So in a few weeks, we are going to have the ND experience at the AANP conference, which is a full day of events for prospective students where you basically get a day in the life of a naturopathic doctor. Come to a conference, come to one of the colleges. So we'll be at Bastien, California in the morning. You start off your day, we'll have some panels on alumni and students talking about why they chose this field and some of the tips and pearls that they wish they knew. And then we'll head over to the AANP conference. You'll have a chance to visit the exhibit hall and mingle with some NDs and maybe take in a little bit of the naturopathic medical students NMSA Cup, which is their big kind of year-end championship. So that's super exciting. If you have any opportunity to come into San Diego, I definitely recommend that. Next month, our webinar is on cancer care from risk reduction to survivorship. And so we hope that if oncology is an area of interest, or if you know of anybody, that you let them know about that. So with that, we shall turn over to some questions. So, Dr. Bastien, would you mind sharing a little bit about maybe some of the biggest opportunities that you see in practicing naturopathic medicine, and specifically with sports related medicine? So what are some of the opportunities that you see for both yourself as a practitioner and for patients?
From the practitioner perspective, you're able to be involved in the success of either your weekend warrior really developing their own skills and their own kind of goals as far as exercise achievements are looking for. You're able to help again with these, like for instance with concussions, you're able to help some of these teams deal with their injuries that would otherwise have sidelined the players for months or years, and deal with them a lot more quickly. So you're able to have these athletes be able to return to play much faster. Is our mic not working again? No?
No, you're good. I can hear you.
Sorry. Okay.
Yeah.
Anyway, so you're able to get involved with these teams and really help them succeed. I mean, we've had instances where we've had a couple of years ago, one of the local hockey teams, like half their team was concussed, and so it was really kind of sad. Just like it became a bit of a running joke that like, well, you must be from that team because you got a concussion again. But because we're able to work with that team, we're able to get those athletes back in operational much faster, and that was quite helpful. From the benefit of I guess the other part is you get to provide that really unique service to your community. You get to be involved and help whatever group you decide to get involved with, help them succeed. Help them not get stuck by some of those normal hurdles that a lot of people will face. Whether you start training and all of a sudden you don't have the nutritional backing to really work on the load you're doing, so therefore it can be really frustrating for those individuals, and so you get to help them kind of guide through that process so they don't end up having to face so many hurdles. Hoping that's a decent enough explanation on that front.
Yeah, no, thank you so much. I think I know that naturopathic medicine has had a role in many professional sports teams and individual players, both professional and high school, Pee Wee League, etc. Throughout the U.S. and Canada. A couple years ago, we had a CCNM grad write a bit for us about naturopathic approaches to sports medicine, who was a silver medalist in the Olympics. So, I know that there's definitely so much help that we have to offer athletes. So one question has come in. If you could speak to furthering knowledge on soft tissue manipulation or manual therapy, what are some of the places that you would recommend folks look into?
Well, I mean, some of the areas that I've delved into have been like the manual or myomatrix release technique, I think, which is kind of a branch off of active release technique. Active release technique on its own, Graston technique, which is a tool technique. There's Bowen. There's any of your more subtle energy therapies like Reiki or healing touch. There's a lot of different avenues. There's another aspect of craniosacral and bristle manipulation. There's a lot that is out there, and again, it's really up to the individual once they're in practice to seek out those different modalities and incorporate them into what it is that they do, and see what works best for them, what resonates well with them, and go from there. So there's just so much out there. There's even, if we get away from the hands-on approach, there's even like laser and ultrasound and TENS, and there's a lot of different modalities out there that you can utilize if you choose to.
Wonderful. Another question came in. If you wouldn't mind speaking, I know that part of getting injured is having scars. Scars happen.
Yeah.
Life happens. Scars happen. So can you speak to methods, techniques, etc., that you use in helping people manage scars and scar tissue?
Scars themselves on the skin are kind of an interesting issue because you have a lot more tools available because you can physically, manipulate them, and you can physically try and move them and do things to them. And they're a little easier to also quantify. When it comes to the scar tissue internally, it's a lot harder to see. If it's significant enough, you'll see it on ultrasound, and you can use that to help guide your therapies. But when let's first talk about when it's more on the skin, a lot of times you'll have, the scar is a buildup of connective tissue. So you'll have this extra tight connective tissue area, which then doesn't move the way that the rest of the body does, and can provide adhesions onto the muscle, which can again impair kind of muscle function or create muscle discomfort. And so one of the therapies that's used for that specifically is something called neural therapy, which is at its core injection of anesthetics so like a numbing agent into the scar. And what that will do is, by pushing the fluid in, you essentially do an internal like fascial release of that scar tissue, which helps loosen it up, and that can dramatically improve how that functions, and it can to some extent improve how it looks. It's not going to be the same as, say, having like a scar surgically redone by a plastic surgeon, but it can reduce the amount that you notice it, because it will then be able to slide better. You can kind of reduce the height of it. Sometimes if you break up that connective tissue, it sort of flattens out a bit more. So those are a couple of the things from the external perspective that you can work on. And of course, beyond that, there's like the massage techniques, whatnot, to try and again just loosen up that scar tissue. From an internal perspective, you're going after some of the same concepts. And again, without guidance by ultrasound, it can be hard to do. But you're trying to basically have that fluid push apart that scar tissue to help give it more pliability and reduce the amount that it's tugging on the different structures within the body. And so, anyway, for prolotherapy, for instance, one of the things that comes up is the worry that we're creating too much scar tissue. And the reality is that because of the regenerative therapy is only stimulating the body to produce more connective tissue with relatively minor irritating agents, you're not going to get the same amount of scar development as you would with a like significant laceration or larger trauma, where you're going to have a lot more connective tissue that has to be laid down to try and hold this thing together. So from the perspective of overall functioning, sometimes even the prolotherapy can be helpful in areas that are more scarred up, because it repair some of those attachment points and then allow the body to move more freely, because the muscles are able to function more appropriately. So sometimes we get into some of the injection therapies, like regenerative therapies in those cases as well.
Great. I've got one other question. So I think the first method that you mentioned in manual therapy was Bowen, correct?
It's one of them.
Yeah. So one other question. Can you speak to some other general tips for vestibular issues from concussion?
Vestibular dysfunction, it really has a whole discipline behind it, mostly within the physiotherapy realm, although it's not limited to that. It involves a lot of essentially stressing the body in the ways that we're creating problems to try and help the body adapt to not being as affected by it. And so there's a lot of eye movement exercises and head rotation with eye movement exercises to try and essentially have the body get used to and relearn how to manage those kinds of stimuli, like the rotational component with the visual field that's static, or moving visual field with the head that's static. So there's lots of exercises and approaches that have been brought about over the last, I'd say about 10 years to 15 years or longer, to try and work on the vestibular component. And that is a lot of times the limit to what most of the concussion centers focus on. And so the use of hormone testing is something that is not widely spread. And so primarily if you're talking about people who have gone to see like a concussion center, it'll be mostly vestibular work. That's going to be mostly a lot of working on balance and eye movement coordination.
Wonderful. Yeah, can you also speak to some of the nutrition therapy that would be used possibly with TBI patients?
That one's tough because it really does depend on the nature of the dysfunction. With traumatic brain injury patients, you're going to have typically it's like a massive stress in the body, and so typically digestion as a whole is under functioning, which means that you're having to work on kind of everything at its base. So you want to be trying to work on making sure they're getting adequate amino acids and protein sources, making sure they're getting good nutrient-rich foods, as kind of unprocessed as they can. Some of the key nutrients relate a lot to kind of neurological repair, and so they get into specific amino acids for neurotransmitter synthesis. You get into some of the nutrients like your antioxidants like glutathione or alpha-lipoic acid, which are going to help with the inflammatory component of the traumatic brain injuries. Sometimes you're working on botanical medicine to try and increase blood flow to the brain, or in other ways increase oxygen utilization by the brain to again help it heal better. Typically, a big component that we end up emphasizing as sort of a general, something when your digestion's not working, but you should probably have, is a little bit of extra mineral support because of your magnesium and zinc are cofactors in hundreds of different metabolic pathways. And so if any of those are being utilized or being used up because of the injury and needing to be raised above sort of that baseline or bottom line level, you're probably going to have to get that from a supplement, sadly. The nutritional component, or the ability to get high levels of zinc and magnesium from food isn't always that easy. If you think about, I want to give you 100 milligrams of zinc, that's like 3 pounds of pumpkin seeds. Like, that's not something that's feasible for someone to get just from food. So sometimes we have to go that supplemental route. The other component to it is going to be blood sugar regulation and kind of overall energy control. If we're having a stressful event, the body will tend towards wanting simple sugars to be able to get quick boosts of energy, which leads to a lot of energy ups and downs. And those low blood sugar times can really perpetuate a lot of concussion symptoms. And so what you end up having to do is really counsel them on making sure that they're having meals that aren't just sugar and kind of no real nutrients, but have some fiber to them to help slow the blood sugar release and help have some fat to them to, again, slow that blood sugar spike or reduce that blood sugar spike, have protein in it to sustain them for longer. So that also plays a part as far as nutrition goes for getting those chronic concussion symptoms or traumatic brain injuries getting better.
Well, I'm not seeing any additional questions coming in right now.
Okay.
If any of you have any additional questions for Dr. Bastien, please feel free to communicate with him as he gave his email address earlier. If you have any additional questions for us here at the AANMC, you can always reach us at info@aanmc.org. That's info@aanmc.org. And thanks so much for coming and joining us today. And with that, we will be concluding our webinar. I'll stay on the line just for a few minutes. Oh no! Question came in.
Okay.
Exercises for patients with TBI as well.
Right. The primary component of the exercise recovery is going to be, well, I would argue the most obvious quote unquote exercises would probably be mostly the vestibular work they're going to be doing. In the initial phases of a traumatic brain injury, you have to rest because elevation of the blood pressure typically aggravates the symptoms and kind of knocks you back pretty well. And so you have to really find out what your tolerance is for activity and not go much above that. In the end, there's not a lot that you can really do to strengthen your brain's recovery from an exercise perspective, but it's a general rule. Being sedentary and isolating yourself isn't going to help stimulate the brain to try to adapt to the injury that's occurred and plastically change to adapt to it. So you end up having to try and do what is within your capacities. For some of these patients, that means little more than going for a walk. And for some of the patients, as they get better, will involve more intense exercises and will involve, kind of, again, return to regular activities. So I wouldn't say there's a lot of specifics from an exercise perspective that you're going to be doing with the brain injury cases, because there's no muscle there. It's all just brain.
Yeah, I am not up on, I know that there was some literature regarding physical therapy and some approaches of moderate exercise for TBIs to increase circulation to the brain and to increase some tributaries and such. I'm not up on the latest literature there, and I know that that has to be done very carefully so as not to get the blood pressure up too high and then start to get into some of the cycle of what Dr. Bastien was mentioning. But there is some literature supporting increasing circulation for brain function and to start to repair some of those connections that may have been damaged from the injury. But that would be, again, something that I would want to, I would definitely have, I wouldn't just say, hey, go on a treadmill. Like that would be, you need to be working with a professional, either a naturopathic doctor or PT that's well-versed in TBI and managing that with exercise.
The other component to think about is there typically isn't a lot of head injury without having the head whip around some way. So there's often a lot of neck injury associated with it, which means that if you're going to be partaking in fairly compressive activities, like you're going to go for a run on concrete, that can aggravate any kind of neck injuries pretty badly, which will again precipitate some of the concussion issues. And so we really have to go very delicately with these patients to make sure that we don't kind of precipitate the other or aggravate the other musculoskeletal injuries that have occurred along with that traumatic brain injury. So that plays a part. The other component, I was reading this article talking about the different approaches between whiplash and concussion, and how with whiplash they want you moving and kind of getting into that active rehab component as quickly as possible, versus with concussion we just tell you to sit back and don't do anything, and how there may actually be a sort of a middle ground where we need to start to stimulate or start to challenge those concussion patients to do something. Typically, if they're coming to see me, they're usually pretty significantly impaired, and we can't get them really like doing a lot of activity that quickly. But it is important to challenge the body at a level that it can tolerate, so that it has to adapt. Without that challenge, we start to degrade. Essentially, we don't adapt to the new environment, and so it is important to stress the body, but the level of stress can look pretty minimal in some of these more significant concussion cases. Anything else?
Oh, I just realized I was muted. Sorry about that.
It's awfully quiet in here.
It was awfully quiet. So I just wanted to say thank you, Dr. Bastien, for joining us today. It was really an informative webinar, and thank you all attendees for coming and joining us on the webinar today. We hope that you can make one of our future events, and please stay in touch if there's anything that we can do to support you in your journey to becoming a naturopathic doctor. Thanks, and hope you have a wonderful day. Take care.
Thank you.
Thank you.